Hi everyone, this is a disclaimer. So let's begin. So these are the fundamental, sorry, the landmark trials in BPAD. Now there may be many, but I feel these are the most important ones. Of course, you may differ in your opinion. The balance trial, the step BD, Boulder 1 and 2, Embolden, as well as Jedi BD. So balance stands for bipolar affective disorder, so BA, lithium का L, anticonvulsant का A, N और C, and evaluation का E. So balance trial. Step BD is the systematic treatment enhancement program of bipolar disorder, not of, but bipolar disorder. Boulder 1 is bipolar depression 1 and 2. So starting with the balance, it is once again bipolar affective disorder, lithium, an anticonvulsant, evaluation. So when was it done? The year was 2001. Done at 41 sites. 41 sites of the US, UK, France, and Italy. It was also done for 24 months of follow-up, done on around 300 patients, so 330 patients पे किया था. So what was the basic research question was that is there a difference in the efficacy of lithium plus valproate combination as compared to either of them alone in a BPAD patient for relapse prevention. So basically what we are trying to see is कि lithium plus valp versus lithium or valp. So this was the research question. Then again, we've covered the research question. we also know the objective, and now we can look at the criteria. So there were some inclusion criteria and some exclusion criteria. Inclusion may more than 16 years old BPAD patients, and the second one was that they should be on long-term maintenance therapy already. एक्सक्लूजन वाले हैं कि कोई अक्यूट एपिसोड है, और भी होंगे, बट द टू इम्पॉर्टेंट वंस वर अक्यूट एपिसोड और any medical complications or risk of those related to valproate या lithium. Now there were some outcomes. The primary outcome was need for any intervention. This can be change in the dosages, any modification of treatment needed. And then there were some secondary outcomes. Secondary में है आपका क्वालिटी ऑफ लाइफ फंक्शनिंग उन्होंने देखी, फिर उन्होंने देखा डेलिबरेट सेल्फ हार्म अटेम्प्ट्स, एनी हॉस्पिटल एडमिशन, एंड फिफ्थ था there were more but adherence or loss of adherence. ठीक है, फिर there was the study procedure. Sorry. The methodology or the procedure was that there was a run-in phase for 4 to 8 weeks. There was a run-in phase for 4 to 8 weeks in which patients were given lithium plus valproate to assess for tolerability. लिथियम की क्या थी 0.4 to 1 मिलीमोल पर लीटर रेंज, valproate की थी up to 1250 or the maximum tolerable dose. Then consent देने वाले, absence of intolerable side effects, and those who maintained compliance for 70% of the time, valproate at least 750 mg पे और लिथियम प्यूटन डोज पे, और ये भी आपको या तो सिर्फ 50 माइक्रोग्राम का लीटर पे था अगर, then they were into the main study. They were randomized. Into lithium plus valproate या lithium. Sorry, the follow-up was for, it was for 24 months. ठीक है. Now results. secondary outcome के hazard ratio was lower for combination statistically from valve alone and not statistically significant. So statistically significant from valve alone and not statistically significant from lithium. In other words, there was no need for any other intervention in the number of people in which there was no need for any other intervention was less for combination therapy, but it was significantly better outcome than valproate than it was for lithium. So combination और lithium में ज़्यादा difference नहीं था, but combination better थी valproate से. Lithium not statistically significant way में, but lesser hazard ratio था of intervention, मतलब better था, ठीक है. And when we look at the secondary outcomes, risk hospitalization similar in all three, and there may no significant difference. But what's important is that this hazard ratio was